Welcome, I'm Dr. Debora Chasse, physical therapist, and with me I have Nicole. And Nicole has some pelvic floor issues, and so we're going to do a quick assessment to determine what is going on with the pelvic floor. First, what I'm going to have her do, so we'll turn to the side, and I put my hands on her greater trochanter. And Nicole, I'm going to have you do a pelvic floor contraction. Do you know how to do that?
Mm-hmm.
Okay, go ahead. All right, and then let it relax. Okay, so she does a good job letting it relax. When she contracts, she's already tight, contracting her pelvic floor muscles, and she's shaking her head, yes. Is that true?
Mm-hmm.
Right, yeah. So if you think of an elevator going from floors 1 through 4, she's already at 3 going up to 4. But she lets go real well, so that's good. All right, so the other thing is, Nicole, I'm going to have you lie down on your back. So next we're going to test the deep multifidi. So lift your back up, and then I'm going to come right behind here, right along the spinous process. And Nicole, I'm not going to have you physically do anything. I only want you to imagine that you have a tail, and I want you to imagine wagging your tail. You're trying. Yeah, so let it relax. All right, and go ahead and do it again. Don't physically do anything.
Okay.
So which one is easiest to go to, the right or the left?
The left.
All right, so go ahead and do it one more time.
Okay.
Right, can you feel that?
Yeah.
Okay, so the right side is weaker. Next, I'm going to palpate the transverse abdominis. And I go to the ASIS and just inferior and medial. So I'm just going to come in. All right. Now imagine that your pelvis are the ends of a book and your sacrum is a book binder. So I don't want you to physically do anything. I want you to imagine closing the book. Good. Okay. So she's contracting her pelvic floor muscles. One a little bit here, a little bit there, a little inconsistent, but you're still contracting them. All right? Now I'm going to put my fingers on your bottom. Are you okay with that?
Yes.
All right. And so here I'm going to place my fingers right where the ischiococcygeus muscle is. And I'm going to ask you to do the same thing.
Okay.
So imagine closing the book. Okay, and relax. Now this time I want you to do a pelvic floor contraction. Good, and let it relax. Okay, really good relaxation. So again, you're starting at level 3, going up to level 4. There's some compensation. So next what I'd like to do is I'm going to introduce Dr. George Roth, who is the developer of Matrix Repatterning. With me, I have Dr. George Roth. He is the developer of Matrix Repatterning, and I've been TAing with him for the training seminars. So I'd like to welcome Dr. George Roth. And would you explain to us about Matrix Repatterning and how it would be beneficial for patients with pelvic floor issues?
Absolutely.
All right.
Okay.
Yeah.
All right. So what I have been able to develop with Matrix Repatterning is an understanding of how certain other tissues affect soft tissues. So one of the main discoveries was the fact that the skeletal frame is often injured with common injuries. And those injuries include falling on the hip, on the ischium, on the sacrum, and even on the lower extremities, and that force is transmitted up into the body and can alter the shape of these structures, which can lead to changes in fascial tension in the pelvic floor and really throughout the entire body. So when we look at the architecture of the pelvis, what seems to happen with injury as force comes in either through the lower extremities or directly through the sacrum from behind is that this is a fluid chamber. And what we know about the physics of internal injuries is that there's a concussive wave that can also be created by these injuries. And so we talk about impact coming into the pelvis, but also an outgoing impact due to the fluid contents. And that's akin to this model here. It's based on this idea that the entire body is made of a continuous structure of fascial connections, which really, when you look down into the cell, there's an actual protein framework that looks something like this, multiplied by thousands of times. And so this is composed of proteins like globulin and myosin and actin inside the cytoskeleton, but it also involves integrin molecules through the extracellular matrix that link one part of the structure to another. So literally an injury in one part of the body is transmitted through the fascia, similar to me pulling on my sweater here. So an injury, let's say in my pelvis, can actually cause the transmission of force throughout the rest of my body. In addition to that, as I mentioned, the internal injuries due to something like a pelvic floor injury, but we see it in the chest area as well. A lot of these fluid-filled organs are very vulnerable to impact because of the fact that water is non-compressible, and so impact, like a water balloon hitting the ground, is going to cause the water to expand outward kinetically and transmit that energy into the surrounding tissues, which can include the organs and also the bone structure that protects them. And that also includes injuries that we see with concussions. Another discovery of mine had to do with the fact that the changes in structure due to injury also create an electromagnetic change in the conduction of current through the body. And that was a discovery that really helped us locate the source of many of these issues. So for example, Debbie, I'll get you to come up here, and when we look at her, some of the issues you've been looking at, there's another test we talk about, which is actually testing the pelvic floor fascia externally, coming from the anterior. So if you want to demonstrate that,
Yeah,
and yeah, it's
gladly.
we teach that.
Right. So what I'm going to do is just come in and see how deep the pelvic floor fascia goes into, and compare that to the other side. And I'm feeling more restrictions on her right side. And do you agree with that?
I agree.
You can
Okay.
feel that. Good. Okay, so this kind of situation we find extremely commonly, and I'm going to show you how we might be able to identify other factors that are contributing to that, which may be coming from some of the other injuries that you've sustained. So can I ask you if you've ever had a fall in your life? On your hips, on your knees, on your tailbone. It's life on planet Earth, right? Okay, so one of the discoveries I made years ago by accident is the fact that there's this electrical property to cells which changes with injury, and that discovery actually happened by accident when I placed my hand on an area and it changed the fascial tension, as you recall from
right.
our discussions in the past, right? So what I'm going to ask Nicole to do in a moment is I'm going to first of all just recheck what you checked here and feel that restricted area in here. And I'm going to simply ask Nicole to place her right hand on her hip like that, right on this area. So if you can see where she's placing her hand, right on the side here, okay? And she just has to just touch that area. It's not even pressure, okay? And just relax now, Nicole. So now what I'm going to do is I'm going to recheck that area and tell me what you notice now.
Wow, it's a lot different.
Yeah.
Yeah, you can go down lower.
It's a lot softer, right?
Softer.
Okay, good. So feel that, and now take your hand away and put it down to the side, okay? And I'm going to give it a couple of seconds. I'm going to recheck it again. Did you notice the difference?
Yeah, I went back to being tight again.
It's tight again, right,
Yeah.
exactly. So this is the kind of discovery we made, that applying certain kinds of stimuli to these tissues alters the way they function mechanically. So we speculated for a long time, what is the influence of placing the hand? And the reality is, if you bump your knee or your hip or your elbow, one of the first things we do without even thinking about it is putting our hand on it,
Right,
right?
right.
Yeah. And so we started to look at why. Why would that have an influence? Well, one thing we know about the hands is that they're extremely sensitive, right? And so the reason for that is because there's a lot of nerve endings. So nerves are electrical conduits, and anything producing an electrical current can produce an electrical field. And so there's been certain studies that have indicated, therapeutic touch and other types of therapies that actually do have a physiological effect on the body. Over the years, then, we developed technology to enhance that field. So one of the devices we came up with was a normalizing magnetic field. And we have Nicole's little baby talking to us offset here. So that's great. So he's a lovely newborn. He's like, 4 months old now?
4 months?
4 months old, great. Okay, and so one of the issues that Nicole experienced, I think you were mentioning, she has this problem with her abdomen, diastasis rectus abdominis, right? And so that developed during the pregnancy, I guess, or during delivery?
During the pregnancy.
Pregnancy, right, okay. All right, so what I'm going to show you is the influence of this type of device, and I'm just checking to see which configuration works best for her. So now I'm going to use her rib cage here. So really what we can do is we can check the entire body by monitoring resistance in one area. And the reason for that, as I mentioned before, one injury can create mechanical stress through the entire body. So by using the rib cage, okay, I can monitor the resistance here. I can place it on an area that I suspect might be an injury, like so, and that influence can alter the flexibility of the rib cage. And I'll compare that to the influence of the left side, okay, and you see it's a lot tighter. Good, okay. All right, so this side actually causes this to relax, which tells me there's likely an injury on the right side, which corresponds to what we saw fascially, okay? So when I check some of the structures here, we can see certain indications of injury. And on this side, there's a large area. There's actually a change in bone structure, which is one of the things we found is that, and this has been verified by studies by Dr. Paul Hansma at the University of California, as we talked about before, and they found by looking inside bone when it's injured, it actually expands. So we see expansion of bone through direct injury, and we see elongation, expansion. And one of the things I noticed here, Nicole, and can you feel how thick that is right
Yes,
there?
I can.
And it's quite sensitive, I would imagine,
It is,
right?
yeah.
Compared to this side,
Yeah, it is.
right? And this side is very, very soft, right? And this side is really, really tight. So this is a major source of tension, likely due to a fall, right? One of the falls that you had. And so by testing that, we can actually specifically go in and target that area. That's a big effect, right? So, and then that's transmitted often into the pelvis because the force coming in through the femur can transmit through the femoral head into the ilium. Okay, so basically, let's have a look at how that affects your pelvic floor. So it's important to demonstrate these things to our patients, right, Debbie? And so we're going to just apply a normalizing influence here, and then notice what that does to her pelvic floor. So that has a little bit of an effect. And as I place it closer to the actual pelvis, we may see even more of an effect, right? Quite soft, all right? Okay, so we're going to apply a little bit of treatment here, okay, and see how this affects a few things that you were testing earlier, okay? So treatment is going to be applying a normalizing magnetic field along with very gentle application of a force we call containment. And that basically what it does is it lines up the cell structure to create what's called piezoelectricity. So an area that's injured actually interrupts that electrical current, causes a break in the flow of electricity through tissue. We know this also from studies on bone, that when you have an injury to bone, it actually alters its electrical properties. So there's a lot of science now that's confirming the things we've found many years ago, right? Okay, so what I'm going to do is apply normalizing, what we call containment through the femur here, focused on this area of injury as well. So a couple of simple releases. This will take a couple of minutes. Okay, so as we continue to release this, you can notice some changes. Do you notice how that's just relaxing?
Yeah, I can feel
right?
it.
It's actually quite an interesting response because there's like a kind of bubbly, tingly feeling and then a warmth, right? Just relaxation. And can you feel how your whole body relaxes a little
Yeah,
bit?
it really does.
It's surprising sometimes how these injuries can influence the entire nervous system, right?
Yeah.
So we've seen that so many times in our
Yeah.
practices. Right. Okay, so good. So we just did a little bit of a release there. Let's have you bend this knee again. So we remember, first of all, how the tone was here in the thigh and how tight it was on this side. So you notice how that feels now? It's a lot
less,
softer,
yeah.
right? And the size has actually changed, and that's probably a little more comfortable now.
It is.
Good. All right.
Yeah.
So that's created a little bit of a change. Okay, so we'll just check that response here in the pelvic floor. And you can see it's already quite a bit better, right?
Yeah,
It's
yeah.
better than before. Good. And so, Debbie, I'm going to take over Anthony. I'll get you to, we'll set up for another treatment. So I'm going to get you to go onto your side,
Okay.
Nicole. Okay. And I'll get you to come all the way back.
And now I'm going to continue with the remainder part of the treatment. I'm going to take 2 bolsters and the scanner, and I'm going to come here on the iliac crest and the ASIS and the AIIS and the ischial tuberosity. And I'm just going to add some containment, and I'm going to stay with this as I feel releases. And what I just feel underneath my hands is just softening of the tissue. And so if my hands are feeling that softening, I can only imagine what's happening inside her pelvic region. And what are you feeling?
It's starting to relax.
Good.
Yeah, it's really
Good.
nice.
All right, now we're going to move on to a different axis. And so now I'm in the Z-axis. So previously it was the Y-axis. Now I'm getting some softening, so I'm going to stay with this longer, but I want to check in with Nicole. How's it feeling? Any changes that you're noticing?
Yeah, I'm noticing, well, it's just, I'm finding that I'm relaxing not just in that area. Like, my body's just starting to feel more relaxed.
Good.
'Cause there's a lot of tension I've been having there, so
Yeah.
that's really
Yeah,
nice.
that's great. Good. Okay. Now, I'm going to have you turn over to your back. All right, so I'm going to come back in and check some of the different things that I tested beforehand.
Okay.
So I'm going to come into the pelvic floor.
Mm-hmm.
Softer, huh?
Yeah. It's softer.
Yeah, a lot
Yeah.
softer there. All right, now I'm going to come to your deep multifidi and let your pelvis relax. Good. So again, imagine that you have a tail
Mm-hmm.
and imagine wagging it. Do you know the difference?
Yeah, I do.
Yeah.
That's so interesting.
Yeah, so now you can wag better in both directions.
Yeah.
Yeah.
Huh.
All right, the next one, we're going to go to the transverse abdominis.
Mm-hmm.
And again, imagine that your pelvis are the ends of a book
Mm-hmm.
and the sacrum's a bookbinder. And imagine closing the book. Big
Yeah.
difference, huh? A
Yeah.
lot stronger.
That's amazing.
Good. And now I'm going to come to the pelvic floor here, the ischiococcygeus muscle.
Okay.
All right, and this time, do a pelvic floor contraction.
Okay.
Wow, feel
Yeah.
the difference?
Yeah. I didn't jump right to 3.
Uh-huh, yeah, you started at 1,
Yeah.
right? So you were able to climb up. And now let it relax. Okay, so one more thing.
Mhm.
Take a breath into your pelvic floor. And when you do, I want you to imagine your sit bones just floating apart.
Okay.
And again. Yeah, see how you can start to let go?
Mm-hmm.
Yeah, that's good.
Great.
Great. So we were able to see some great changes.
Okay, so yeah, that was a great experience, and,
Mhm.
and you saw
Yeah.
how much change you can make in
Yeah.
a very short time.
Yeah.
And one of the things I wanted to mention, as you all know, is that bone is actually a fascial element. It's actually quite plastic. It's something that most people have not recognized,
Mhm.
but certain scientists are starting to realize. And this is because bone is mainly composed of collagen. It's mineralized collagen, but that collagen is actually very plastic, and it has piezoelectric properties, which are affected by injury and therefore can also be affected by treatment.
Mhm.
And when you have that surrounding structure in the pelvic floor, for example,
Yeah.
that creates fascial tension that changes the mechanics of the muscles, the fascia, the organs in that area,
Mhm.
and really can affect any part of the body. So,
Yeah, yeah.
yeah.
Yeah, no, that was a very fast release
Yeah.
and made some big changes very quickly for her.
Good.
Yeah,
And I'm,
so,
I'm so delighted that you're finding this useful in your work. I know you're doing some
Yeah.
great work with improving pelvic mechanics and
Mhm.
pelvic floor function in women.
Yeah.
And
Mhm.
I'm delighted that you're able to use
Yeah.
some of these techniques.
well, and thank you for taking the time to demonstrate this
That's
with
my
me.
pleasure.
Yeah, yeah.
Okay, thank you for being such a helpful instructor and helping us
Thank you.
develop this program over the years.
Yeah, thank you
Okay.
so much.
Pleasure.